Hi, my name is Jessie, and I'm a waiting child specialist for the Waiting Child program with Gwca China Adoption. In our program, we see many different special needs. Some of these needs may be pretty common in the United States, and some may be more specific to the Chinese culture. Our hope is to be able to provide you with more information on specific special needs as you move forward through your adoption journey. November is National Epilepsy Awareness Month, and Gwca is proud to present you with more information on this special need. Epilepsy is a central nervous system disorder in which nerve cell activity in your brain is disturbed, causing a seizure in which you'd experience abnormal behavior, symptoms, and sensation may include a loss of consciousness. Seizure symptoms may vary. Some people with epilepsy stare blankly for a few seconds, and others repeatedly twitch their arms and legs. About 1 in every 100 people in the United States may experience at least one seizure in your lifetime. However, one seizure does not signify that you have epilepsy. Even mild seizures may require treatment because they can be dangerous during certain activities, and we'll go through all of this a little bit later. So some causes of epilepsy can really vary, and most of the time in kiddos we see that we don't exactly know what causes their epilepsy. Some things that can cause it are certain illnesses, brain malformations, trauma to the brain, certain metabolic disorders, brain tumors, some strokes, chromosomes disorders, but it's going to really depend on your kiddo as to what might cause their epileptic seizures. In order to diagnose epilepsy, it requires that you've had at least 2 seizures in your lifetime. The doctor initially, when you may go through a lot of patient history, do some exams, blood testing, and they really want to indicate that you have epileptic seizures and maybe not some other type of disorder going on, such as fainting, breath holding, especially in kiddos, transient ischemia attacks, or hypoglycemia. Seizures can also be isolated and may not necessarily indicate that they have epilepsy. The main tools in order to diagnose epilepsy is that your doctor is really going to go into all of your medical history and look for any indications as to what happens around the time of a seizure. Additionally, they may go through and use a diagnostic screening tool known as an electroencephalogram or an EEG. It's a machine that records brainwaves picked up by tiny wires that are taped to the head. These electric signals from the brain are recorded as wavy lines by the machine, and you can see an example of one up on the screen. Brainwaves during the seizures may indicate a type of pattern that may help the doctor diagnose what exact type of epilepsy your child may have. Another screening tool, a CT or an MRI, may be used to actually take a look at the brain itself and look for any growth or any malformations in the brain itself that may be causing the seizures. There's additional technology that's coming out that a lot of places have. However, when you get your testing in a case file in from the orphanage, a lot of times you're going to see EEGs or CT scans, again, like you see up on the screen now. So what does a seizure look like? There's going to be many different types of seizures. The most common one and kind of the most dramatic one that you're going to see is a grand mal seizure. It's going to cause the patient to lose consciousness and usually collapse. There's going to be 2 phases called the tonic phase and the clonic phase. The tonic phase is going to be a stiffening of all the muscles, and the clonic phase is going to be a jerking. So typically these last anywhere from 30 seconds to 1 minute. However, what happens during those grand mal seizures, some injuries can occur because a lot of times they will bite their tongue or fall somewhere and hit their head or other body parts on different objects around them. Another type of seizures is called absent seizures, and it's a short loss of consciousness with very few symptoms. So sometimes it may just mean a kiddo staring at a wall for a little while and may not be aware that they're doing it, so they may lose a little bit of time in their memory. Myoclonic seizures are going to be sporadic jerks, usually on both sides of the body. Sometimes, people have described these as electrical shocks. And, when they're really bad, somebody might throw something accidentally or knock something over accidentally due to that sudden jerk. Clonic seizures are repetitive rhythmic jerks, and it's usually on both sides of the body at the same time. Tonic seizures are going to be that stiffening of the muscles. And again, you see both of those within the grand mal seizure. Atonic seizures are going to be a loss of muscle tone, so they might fall or collapse because their muscles give out on them all of a sudden. Smaller types of seizures that happen really, really deep in the brain and that, might not be able to be picked up on an EEG are going to be called partial seizures. And they're going to be, they're categorized into simple and complex. Simple seizures, you're not really going to see a whole lot of outward side effects. So a simple motor may just mean a simple jerking or head turn. And usually the kiddo is going to be aware that they're doing these things. So a simple sensory seizure may look like an unusual sensation in either their vision, their hearing, any of their 5 senses. Simple psychological seizures are going to be a memory or emotional disturbance that might happen. So they might be aware, but they might not be able to, quite think as quickly as they can, or they may get a memory of something. Complex seizures are going to be an impairment of awareness. So sometimes kiddos may repeat emotions such as like lip smacking, chewing, or fidgeting, and they're not really going to be aware that they're doing that stuff. Partial seizures with secondary generalization, symptoms are initially going to be associated with a preservation of consciousness, and eventually they'll lose consciousness with whatever they're doing at that time. So some treatment options for seizures are going to be, most of them are managed with medication. So a lot of times it's just one anti-seizure medication or anti-epileptic medication. And a lot of times you're able to decrease the frequency or intensity of the seizures by taking these medications. Your doctor will be able to advise kind of an appropriate time to stop taking the medications. If you're able to manage on the medications, they may taper down on these. More than half of children with epilepsy who are experiencing epilepsy symptoms can eventually discontinue medications and live a seizure-free life. Many adults can also discontinue these medications after 2 or more years without seizures. Finding the right medication can be kind of complex, and it might take a couple different medications and dosages to get the right combination, and your doctor will definitely be able to help you out with that. Anti-seizure medications may have some side effects that you'll need to be aware of. Weight gain, lack of bone density, skin rashes, loss of coordination, speech problems, memory problems, and they can have some more severe side effects that you'll need to be aware of, such as depression, suicidal thoughts, or severe rashes. Also inflammation of certain organs like your liver, so you're really going to need to monitor sodium intake, and that's going to depend on the medication that your kiddo's taking. Another type of treatment or intervention that may be able to be used is a surgery. If your epilepsy is contained in a specific part of your brain that doesn't interfere with vital functions like speech, language, motor, vision, or hearing, your doctor may be able to go in and remove just that one little section of your brain and stop the seizures altogether. But if they originate in an area of the brain that controls movement, speech, or other functions, you may be awake during part of the surgery. And sometimes your seizures are going to be in a part of your brain that may not necessarily be able to be removed, and your doctor may recommend a different type of surgery where they make multiple little cuts in your brain so that the seizure triggers can't trigger from one side to the other of that cut. There's also a type of therapy called vagal nerve stimulation. It's a little implant that the doctor implants in your chest. There's a picture of it up on your screen, and it's going to look similar to a pacemaker. So wires from that go up and connect into the brain, and there's a little battery that operates it, and you may be able to wave its little sensor over it if you're able to tell when you're about to have a seizure. So it's going to require a specific type of seizure to come on, and it's definitely not right for everybody. You're going to have to be pretty aware of when your seizures are coming. You may get an aura or a light. You may smell a specific smell, and that's when you can wave that little wand over your vagal nerve stimulator and maybe delay the onset or decrease the likelihood that that seizure will come on. There's also different types of diets that your child can go on, and usually those are high-fat, low-carb diets. And those fats are going to be really good fats for your brain because your brain is made entirely of fat. So you're really going to want to increase your brain health by increasing your fats, and that may be a better holistic way of treating your seizures. So the effects of seizures are going to depend on every kiddo. It is definitely not a mental illness, and that's kind of a common myth that you'll see It doesn't typically worsen over time, so usually you can manage your seizures more and more as your kiddo gets older and learns how to manage their medication and stuff like that. However, there are some kind of other side effects as far as seizures go. School may be affected if your kiddo, might have some anxiety about going to school if they're having a lot of seizures. They may miss time in school for doctor's appointments. There's also a lot in the brain that happens whenever you have a seizure, and the brain's always kind of growing and functioning, and you're getting more synapses in your brain, and sometimes those can be affected by when a seizure happens, especially if they're happening really frequently. Also, sometimes if your kiddos are having a lot of seizures at night, they may not be sleeping very well, which obviously can affect kiddos in a big way, but it also can, again, cause them to miss more school, and that can have an effect on their learning ability. So living with epilepsy, what's that going to look like for your kiddo? Again, we talked about school and learning, so any type of partial seizure that your kiddo might have while they're in school may have kind of no effect on their learning ability because they just might blink out for a couple seconds. But the generalized seizures or seizures that happen in a larger portion of the brain may have profound impacts on learning and may even affect their overall intelligence. Early diagnosis and the age that the seizures had their onset are going to be kind of determining factors, and the faster that you can get an intervention in place and try to control this is going to be the best option for your kiddo. Another thing to think about is kind of the social implications. So sometimes they'll develop behavioral or emotional effects from having seizures due to like the unknown. They don't know if they're going to have a seizure in school or outside of school. So creating a positive self-image for them and giving them resources and tools and a lot of knowledge about their special need is going to be really important for them. So as far as recreation goes, a lot of times they can participate in many different activities as long as it's not going to be an activity that they're going to need to make a snap judgment in. So for instance, they don't recommend skydiving or any type of vehicle racing because any momentary lapse in consciousness may result in a pretty extreme consequence from that. So sometimes they don't recommend contact sports. But that's also going to depend on the type of seizures that your kiddo has, and your doctor would be able to tell you more about that. As far as employment goes, as part of the American Disabilities Act, employment is not able to be restricted based on a special need that a kiddo has. However, later on in life, if they're having a lot of seizures and having to take a lot of time off of work, that can affect their attendance record with their work and might result in some bigger consequences. And I came across a study that said that people with epilepsy have a higher unemployment rate due to having frequent doctor's visits or due to having to miss out on work. I think it also has to do with the social anxiety that might come around from being in a new workplace. So what do I do if my kiddo has a seizure? You want to move away anything around the kiddo that they might be able to hit their head on, or they might hit any other type of their body on. You want to put something soft under their head to prevent them from hitting their head on the floor. You want to try to turn them gently to the side so that if they were to vomit while they're having a seizure, they don't choke on it, or any spit that they don't choke on that either. You want to loosen anything around their neck that might, cause a restriction to their airway, and you want to keep how long the seizure lasts. You definitely don't want to try to hold down the child or stop them from seizing because they're not going to be able to stop themselves. So you just want to make sure that you're really calm. You want to be there for them, and you want to make sure that they do not have any other consequences as falling, stuff like that. You don't necessarily need to seek medical attention every time that your kiddo has a seizure. If they're having very long seizures, any seizure that lasts longer than 5 minutes, you want to seek medical attention. If it's a different type of seizure than what you're used to seeing, you obviously want to consult your doctor. Or if they're having many, many seizures kind of back to back, you would like to consult your doctor about that. So the most important thing you can do is stay calm, don't restrain, and really kind of take note. What was the kiddo doing before the seizure happened? What were they doing during the seizure? Any notes that you can make to tell your doctor are going to be really important. The other thing that you can do is watch for trigger signs with seizures. So sometimes kiddos, if they spike a high fever, it might trigger a seizure, especially over 102 degrees. And if it rises really quickly, it's a warning sign. If they miss their medication or medication routine, then that's going to be important to know that they might have a seizure then. Lights may trigger them, strobe lights or fireworks might. Any type of abnormal behaviors, if they get really agitated, anything that's going to cause that stress and anxiety to really skyrocket might be a warning sign that they're about to have a seizure. Certain foods, foods that are really, really sugary, may have them to have a seizure, and if they're going through any type of hormone change, it might affect their disorder and might make them have more seizures than normal. So what can you do for your kiddo? The Epilepsy Foundation, which is a resource, a really, really great resource that I list at the end of this presentation, might be able to help you get more resources to your kiddo. So you want to teach them. You want to teach them in an age-appropriate way to really have a positive outlook. Yes, they're different. They have this special need. But that doesn't make them weird. It doesn't make them uncool, anything like that. So you want to give them resources and information so that they can explain it to their friends, so that they have accurate information. So if somebody tells them something that isn't true, they know that that's not true about themselves. So really teaching them to be positive and have a really positive self-image is going to be really important. Teach those around you about epilepsy. So talk to their teachers. Make sure that their teachers know what to do. Maybe talk to their classmates if your kiddo would be okay with that. Just let everybody know, and again, have factual information. That's going to be important because you don't want these kiddos getting out around the rumor mill and then it getting back to your kiddo, and that might cause more social anxiety. Anybody who watches your kiddo, you're going to want to make sure that they have a lot of information about the special need to make sure that they're equipped in case something were to happen. So also getting support groups, again, it's the Epilepsy Foundation. They have local support groups that you might be able to join because somebody obviously is going through this with you. So you want to join up with parents. Maybe they have some parenting advice, people that have been through it before. Definitely creating that support network of people is going to be really important. You want to include your whole family in the education process in case your kiddo's with their brother or sister, aunt, uncle, whoever it is, and they might have a seizure. You want to make sure that they know what to do in case that were to happen. You also want to establish routines. That's going to be really important, especially if they're taking medications. They need to be taken at the same time every day, maybe with food, and you want to make sure that that happens at the exact time because that can definitely have an effect. So here are some resources that you might want to consult if you're looking more into epilepsy. Thank you so much for taking part in our presentation. And please, if you have any questions, give us a call here at Great Wall, 512-323-9595. Thank you so much.